Let's discuss the Sinew channel, bladder channel. Pathway. The bladder sinew channel begins on the lateral aspect of the little toe and travels along the lateral border of the foot to the lateral malleolus, where it binds. At the lateral malleolus, 3 branches separates from the sinuous channel. One branch runs to the calcaneus, where it binds and disperses over the heel. A further branch ascends the lateral aspect of the lower leg and binds at the head of the fibula, where it also meets the gallbladder and stomach sinuous channel at GB 34. The main branch travels to the Achilles tendon, binds in the area of the 2 heads of the gastrocnemius muscle, ascends the posterior aspect of the leg along the gastrocnemius and soleus muscles, and binds on either side of the popliteal crease, ascends the posterior aspect of the thigh and binds at the center of the popliteal crease, ascends as a broad band along the spine and binds at bladder 10. 2 branches separates from the main branch in the thoracic region at the level of the axilla. 1 branch ascends to the shoulder and reaches LI 15. The other branch penetrates the axilla, ascends the thorax, and runs to the supraclavicular fossa, where again 2 sub-branches separates. 1 sub-branch ascends to the mastoid process to GB12. The other sub-branch crosses the cheek to SI18, where it meets with the other foot-yang sinuous channel. The main branch divides at bladder 10 and 2 branches. 1 branch penetrates deeper to the root of the tongue. The other branch crosses the head lateral to the midline, reaches the inner canthus of the eye, and separates into 2 branches. 1 branch binds lateral to the nose and descends the cheek. The other branch crosses the upper eyelid and connects with the stomach sinus channel together, forming a network around the eye. It then penetrates deeper into the upper orbital region and ends at the root of the mouth. Clinical importance: pathology, muscular cramping in the region of the little toe, tensions and pain in the heel, stiffness and limited range of motion of the joints, tension and stiffness in the back and along the spine, and difficulty when bending forward, inability to lift the arm above the shoulder region, stiffness or distending pain in the axillary region, pain and tense musculature in the supraclavicular fossa, limited range of motion of the cervical spine. Indication mainly with B syndrome, painful obstructional syndrome along the bladder channel. The area covered by the bladder sinew channel is larger than that covered by the bladder primary channel. This explains why the bladder primary channel points can also be used for disorders in the scapula and the shoulder region, as well as for disorders in the lower eyelid and the nasal region.